If you've ever had a blood test come back normal, but you're still tired all the time, this video is going to explain why ferritin might be the issue. And if you're a person who menstruates, this is especially relevant for you. But first, what is ferritin? Ferritin is the body's primary iron storage protein. Your body stores iron inside ferritin molecules, mostly in the liver, spleen, and bone marrow, and then releases it into the bloodstream as needed. While only a small percentage of your ferritin is circulating in the blood, it's the best measure we have of a person's iron reserve. The most commonly reported symptom of low ferritin is fatigue. Other reported symptoms include brain fog, difficulty concentrating, headaches, hair loss, restless legs, and generally feeling run down. I want to be careful here and not overstate things. Fatigue and these other symptoms have many possible causes, and low ferritin is only one of them. The presence of these symptoms doesn't confirm low ferritin, and low ferritin doesn't guarantee you'll have these symptoms. Standard blood tests check something called a full blood count, or CBC. This looks at your red blood cells, their number, size, and hemoglobin levels. If hemoglobin drops low enough, you get diagnosed with anemia. There's also a serum iron test, which measures the iron circulating in your blood at a given moment, but it fluctuates throughout the day and doesn't reflect your overall stores. Ferritin is different. It can be low for a significant period of time before your hemoglobin or serum iron are obviously affected. So it's possible to have depleted iron stores and all the symptoms that come with that, while your other tests still look normal. This is called iron deficiency without anemia, and it's a real and recognized clinical condition. In terms of what level is considered low, this is a debated area. There's no universally agreed upon lower threshold for ferritin. Some people report feeling completely fine at a ferritin of 30 micrograms per liter. Others find their symptoms don't resolve until ferritin gets above 100. The official WHO and CDC cutoffs are 15 micrograms per liter, but there's a growing body of research suggesting those thresholds are too low and miss a substantial portion of people who are iron deficient. What this means practically is that if you are experiencing symptoms, it's worth getting your ferritin level tested. Fatigue is not evenly distributed across the population. Women consistently report it at significantly higher rates than men. Fatigue in these groups has many factors. I'm not saying ferritin explains all of this, but it is part of the picture, and it's one of the actionable things you can test for and address. So why are women of reproductive age particularly at risk? The typical ferritin in an adult man is around 120 to 135 micrograms per liter. In a premenopausal woman, it's closer to 35 to 45, roughly 3 times lower. And that gap is primarily driven by menstrual blood loss. Other groups who are disproportionately affected include endurance runners, vegetarians and vegans, pregnant women, adolescents going through their first periods, frequent blood donors, and people with gastrointestinal conditions like celiac disease or inflammatory bowel disease that impair iron absorption. Here's an important caveat. Your body produces more ferritin in response to infection or inflammation. This is why it can be useful to also check a marker like C-reactive protein, or CRP, at the same time. CRP is a marker of inflammation. If your CRP is elevated, it means your ferritin result may not be a reliable snapshot of your iron stores. In that case, retesting once the inflammation has resolved would give a more accurate measure. If you get your ferritin checked and you or your doctor determines it's worth treating, the approach depends on the severity, the cause, and your individual health context. For most people, that means oral iron supplementation. But in cases where that doesn't work, intravenous iron infusion is an option. I'm not going to go into protocols here because this is an individual question, and more importantly, taking supplemental iron when you don't need it isn't harmless. This isn't something to self-treat without guidance. So to summarize, ferritin is your body's main iron storage protein, and it can drop to levels that cause symptoms before a blood test flags anything abnormal. The most common symptom is fatigue. Women of reproductive age are at elevated risk due to regular iron loss through menstruation. Ferritin is not part of the standard panel, so if you are having symptoms, definitely ask to get it checked. If you found this useful, please like, subscribe, and share it with someone who might benefit. As always, nothing here is medical advice. It's just information to help you become better informed. This video is designed to be updated, so if you think I missed something, please let me know in the comments.